Introduction: French Bulldogs are frequently affected by intervertebral disc herniations, which can lead to hind limb paralysis. A significant number of these dogs experience bleeding within the vertebral canal in addition to the disc herniation, causing spinal cord compression. This bleeding, known as epidural hemorrhage, is a common complication that can worsen the neurological condition. This study focuses on the relationship between the location of disc herniation in the thoracolumbar spine and the presence of extensive epidural hemorrhage, or EH, specifically in French Bulldogs. Previous research has shown that French Bulldogs develop epidural hemorrhage more often than other breeds, including Dachshunds and other non-chondrodystrophic dogs. The most common site for disc extrusion across all dog breeds is the thoracolumbar junction at T12/T13. However, epidural hemorrhage seems more common with disc extrusion at the L4/5 level in other breeds. The association between disc herniation location and epidural hemorrhage is debated, with some studies suggesting it is more common with caudal thoracic or thoracolumbar disc extrusion in French Bulldogs, and other studies disagreeing. This study aimed to determine if certain sites of disc extrusion in the thoracic and lumbar spine of French Bulldogs are more prone to developing EH. The authors hypothesized that EH would be more prevalent with disc extrusion at specific caudal lumbar sites. The presence of erythrocytes and macrophages containing blood degradation products characterize epidural hemorrhage, which is believed to cause epidural inflammation. It is important to consider epidural inflammation in intervertebral disc herniation, as dogs with extensive epidural hemorrhage have less favorable outcomes, and the contact area between the epidural hemorrhage and the spinal cord is more critical for prognosis than the extent of spinal cord compression. In addition, dogs with minimal epidural inflammation have a better prognosis for regaining ambulation. Domestic dog breeds with the chondrodystrophic phenotype, like French Bulldogs, are strongly associated with the expression of the FGF4 retro gene, which appears to be associated with intervertebral disc disease. Materials and methods: This retrospective study examined the magnetic resonance imaging, or MRI, scans of 148 French Bulldogs diagnosed with thoracolumbar intervertebral disc extrusion. The dogs included in the study presented with paraparesis, which is weakness, or paraplegia, which is paralysis, localized to the T3, L3 or L4, S3 spinal cord segments. The onset of these symptoms had to be less than 14 days before presentation, and all dogs had an MRI diagnosis of intervertebral disc extrusion between the years 2012 and 2022. Dogs were classified based on whether they had deep pain perception. The deep pain positive group included dogs with different degrees of paraparesis and paraplegia that still had deep pain perception. The deep pain negative group included paraplegic dogs that lacked deep pain perception. Dogs with unilateral sensor motor loss were included in the deep pain positive group. All the MRI protocols included a T2 weighted sequence in the sagittal and transverse planes, a T1 weighted sequence in the transverse or dorsal plane, a T2 weighted fat suppressed sequence in the dorsal plane, and a T2 star gradient echo sequence in the transverse plane. Dogs were excluded from the study if their MRI images did not allow for correct counting of the vertebrae or if the required MRI sequences were incomplete. The vertebra with the last pair of ribs was defined as T13. The MRI images were acquired using 1.0 Tesla, 1.5 Tesla, and 3.0 Tesla magnets. The images were evaluated by a senior resident and a board-certified radiologist, who were blinded to the original reports, using a specialized DICOM viewer. The location of the intervertebral disc extrusion was determined based on the narrowing of the intervertebral disc space, reduced signal intensity and volume of the nucleus pulposus on T2 weighted images, asymmetric protrusion of the annulus, annular tear, and the presence of T1 weighted and T2 weighted hypointense material within the vertebral canal. Disc extrusion was classified as thoracic if it occurred between T1/T2 and T12/T13, and lumbar if it occurred between T13/L1 and L6/L7. Epidural hemorrhage was identified by the presence of material within the epidural space that had mixed signal intensity on T2 weighted images, ISO-, hypo-, or hyperintense signals compared to the normal spinal cord on T1 weighted images, and a signal void on T2 star gradient echo sequences. EH was defined as the extension of epidural hemorrhage over more than two consecutive intervertebral disc spaces, and the extent was expressed in multiples of the length of the L2 vertebral body. The researchers also recorded the location of the epidural material, in relation to the affected disc space, including whether it was cranial, caudal, or both, and its craniocaudal extent expressed in multiples of the L2 vertebral body length. The location of the material in relation to the spinal cord was also evaluated, dividing the transverse sections into the dorsal right, dorsal left, and ventral right quadrants. The location of maximal compression with respect to the affected intervertebral disc space was recorded. Spinal cord compression was assessed as mild, moderate, or severe, based on the percentage of compression, and intramedullary signal void in T2 gradient echo sequences was noted. The recovery of deep pain perception in dogs that were initially deep pain negative was also recorded at the time of discharge. Statistical analyses included the use of the Fisher's exact test and the chi-squared test to compare the location of intervertebral disc extrusion and the proportion of EH. The collected variables were described by means and standard deviations for normally distributed data, and median and interquartile ranges for non-normally distributed data. Categorical variables were expressed as numbers and percentages. Results: the study included 148 French Bulldogs, 87 males and 61 females. The median age of the dogs was 4.02 years, with a range from 0.2 to 8.77 years. The mean weight was 13.12 kilograms. 12 of the dogs had previously had a hemilaminectomy for intervertebral disc disease. Most of the MRI examinations, 132, were performed using a 1 Tesla magnet, while 4 were performed with a 1.5 Tesla magnet, and 12 with a 3 Tesla magnet. 121 of the dogs were classified as deep pain positive, and 27 were classified as deep pain negative. Epidural hemorrhage was observed in 144 of the 148 dogs, which is 97%. The longitudinal extent of the hemorrhage ranged from 1 to 6.5 vertebral body lengths, with a median of 2.5. In 104 dogs, 70.3%, the epidural hemorrhage extended over more than 2 consecutive intervertebral disc spaces and was thus classified as EH. In this EH group, the hemorrhage extent ranged from 2 to 6.5 vertebral body lengths, with a median of 3. 44 dogs had epidural hemorrhage, but not extensive epidural hemorrhage, and this non-EH group had hemorrhage that ranged from 1 to 2 vertebral body lengths, with a median of 1.5. There were no significant differences in age, sex, or body weight between the EH and non-EH groups. The epidural material extended cranially in relation to the affected intervertebral disc space in all dogs, and caudally in all but 2 dogs from the non-EH group. In the EH group, the median extent was 2 times the length of L2 in the cranial direction and 1 time the length of L2 in the caudal direction. In the non-EH group, the median extent was 1 times the length of L2 in both the cranial and caudal directions. 18 of the 104 dogs in the EH group were deep pain negative, and 9 of the 44 dogs in the non-EH group were deep pain negative. There was no significant difference between the 2 groups concerning deep pain sensation. The most frequent site of intervertebral disc extrusion for the entire study population was L4/L5, which is 22%, followed by L3/L4 at 20%, T13/L1 at 16%, and L1/L2 at 13%. The affected intervertebral disc space was classified as lumbar in 139 of the 148 French Bulldogs and thoracic in 9 of 148 dogs. In the EH group, the most affected location was L4/L5 followed by L3/L4, L1/L2, T13/L1 and then L2/L3 and L5/L6. For the non-EH group, the most commonly affected locations were L3/L4 and L4/L5, followed by T13/L1. The highest prevalence of dogs with EH across all the thoracolumbar sites was at L1/L2, where 84% of the dogs with disc extrusion at that location had EH. This was followed by L5/L6 with 81%, L2/L3 with 72%, and L4/L5 with 66%. At the thoracolumbar junction, 65% of dogs had EH. For all lumbar sites combined, 70.5% exhibited EH, while for all thoracic sites combined, 66.9% exhibited EH. There was no statistically significant difference in the prevalence of EH between the specific sites of the thoracic or lumbar spine. Figure 1 illustrates the number of dogs with EH and without EH at each site of disc extrusion. The material within the vertebral canal was found to be in the left ventral quadrant in 68% of the dogs, the right ventral quadrant in 67%, the left dorsal quadrant in 64%, and the right dorsal quadrant in 54%. The distribution of the material in the vertebral canal is shown in Figure 2 for both the EH and non-EH groups. Material was present in only one quadrant in 4 dogs total, 3 in the non-EH group and 1 in the EH group. However, in the EH group, the material was present in one or both dorsal quadrants in 98% of dogs. The involvement of both dorsal quadrants was significantly associated with EH. Figure 3 depicts a 5-year-old French Bulldog with epidural material extending cranially. Spinal cord compression was assessed as mild in 16% of dogs, moderate in 51%, and severe in 33%. There was no statistically significant difference between the EH and non-EH groups concerning the grade of spinal cord compression. The maximal compression was dorsal to the affected intervertebral disc space or up to 0.5 vertebral body lengths away from it in 82% of the EH group and 93% of the non-EH group. Maximal compression that was further away from the affected intervertebral disc space was seen more frequently in the EH group. Figure 4 shows a 5-year-old French Bulldog with severe spinal cord compression from the left dorsal side. Lateralization of compression was seen in 95% of EH dogs and 86% of non-EH dogs. Intramedullary hemorrhage was observed in 6% of the EH group and 2% of the non-EH group. Decompressive surgery was performed in 90% of the dogs, and EH was associated with decompressive surgery at more than one location. Of the deep pain negative dogs, 10 regained deep pain perception by discharge, 9 of those being in the EH group and 1 in the non-EH group. Discussion. This study of 148 French Bulldogs showed that the most common location of intervertebral disc extrusion was L4/L5. This is a breed-specific finding as, in general, disc extrusion occurs most commonly at the thoracolumbar junction. The study revealed that 70% of the dogs had imaging findings consistent with EH. The highest prevalence of EH was seen at L1/L2, which was 84%. However, there was no statistically significant difference between the different sites of disc extrusion in the thoracic and lumbar spine and the prevalence of EH. While the study found the most frequent site of disc extrusion to be L4/L5, the highest percentage of EH was at the L1/L2 location, closely followed by L5/L6. The authors note that previous studies have shown conflicting results regarding the location of disc extrusion and the presence of EH. The study's findings suggest that the subjective impression of increased EH at caudal lumbar sites may be due to the high incidence of lumbar disc extrusions in general. The study highlights that epidural hemorrhage was observed in almost every French Bulldog with thoracolumbar disc extrusion, emphasizing the importance of differentiating between epidural hemorrhage and extensive epidural hemorrhage. The definition used for extensive epidural hemorrhage included the extension of the hemorrhage over more than 2 consecutive vertebral disc spaces. The study supports prior findings of a higher incidence of EH in French Bulldogs compared to other breeds. In the present study, there was an association of dorsal quadrant involvement of the vertebral canal with EH. In particular, the presence of material in both dorsal quadrants was significantly associated with EH, while material being present in the dorsal quadrants without material in the ventral quadrants was only observed in the EH group. The site of maximal compression was most commonly directly dorsal to the affected intervertebral disc space. The maximal compression being cranial or caudal to the affected disc space was more common in dogs with EH. The intramedullary signal voids indicating intramedullary hemorrhage were only seen in 6% of the dogs. Intramedullary hemorrhage has been associated with a reduced likelihood of regaining nociception. The study mentioned limitations, such as its retrospective design and that it did not include surgical findings or histological confirmation of the extruded material. The potential for misdiagnosing extruded disc material as hemorrhage based on MRI was discussed. The use of 3 different MRI magnets could have also introduced variability into the imaging and detection of artifacts. Another limitation was the inability to evaluate the influence of corticosteroid administration or long-term outcomes. Advanced imaging techniques such as susceptibility-weighted imaging or multi-echo sequences might offer better visualization of hemorrhagic lesions compared to traditional T2 star sequences. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.